Hi guys, welcome back to the channel. Thank you for joining me and thank you for your continued support. So, I find it amazing in a bad way that the government don't seem to see the impact of what they do. I mean, Labour aren't the only party that do this. Conservatives did it in 15 years before that. They have no clue that what they're doing could have a knock-on effect on something else. Or when one minister says, well, we're going to be doing this, another minister will do something which will cause even more problems to the first minister, or what the first minister is trying to do. Let me explain. So there's this article which is saying that Wedge Streeting, in his wisdom, is going to cut funding for mental health services in the NHS. Now, this amazes me really, because when you think about what Rachel Reeves was saying yesterday, that they're cutting the benefit bill, and we know they're targeting people with mental health. We know they are. They're targeting the young people with mental health in particular, mental health problems, I should say, in particular. We know that they're doing this, and yet rather than increase the budget for mental health services to try and help those people who may have problems with their mental health, they're going to cut the funding that goes towards mental health services. Now, Wes Streeting has said that in his defence, he's going to be putting money into GPs' practices, which will have a knock-on effect on mental health. But that's not necessarily the case. I mean, okay, if you've got a mild mental health problem, if you're a little bit anxious, if you've got perhaps a depression or something like that, something which can be dealt with in a fairly easy way, and I'm not saying that that's the case for everyone, but if it's something that maybe a GP can deal with, that's fine. But we know that there's lots of mental health problems out there that can't be dealt with by a GP and need further input and further support. So cutting this funding for the NHS mental health provision is a bonkers idea. Now, it's going to be something like 0.07% cut, which is what he said, which is what they're saying. But that's certainly going to have a knock-on effect when you think that Labour are telling people to go back to work. They're telling people that if you have mental health problems, that you can go back to work, that work's good for you, but they're not going to help you do it. They're not going to help you. They're not going to help your mental health, so that there could be a case where you could go back to work. They're actually going to cut the funding, so you're now going to be there with your mental health problems, and they're not going to help you fix them or manage them, but they're still going to want you to get a job. I find it absolutely bizarre. Absolutely bizarre. I'm going to leave a link to the article in the description below so that you can see it, but it just beggars belief. It really does when you see this happening. I also saw, because I'm sure someone will mention it in the comments, the deputy leader of Reform UK saying that lots of people who've got mental health problems, it's the modern day equivalent of having a bad back, and that most of them are swinging the lead. Words to that effect. So I'm not even going to talk about that person, because I think that he just doesn't have a clue. He also said, people are on benefits tax-free. Well, people on benefits do pay tax. I mean, okay, they get it tax-free. It's not taxed in that sense of the word, but we pay taxes. We go out and we buy things that there's VAT and stuff like that. The man hasn't got a clue. Anyway, so that's basically what the situation is at the moment. They're looking to cut funding for mental health services, even though they want people who have poor mental health to go back to work. I really think this is going to go badly wrong for them, because it just defies logic, in my sense of the word. You would think they'd be raising the funding for mental health to try and help people get well enough to get back to work, but no, that's their logic. Let me know down in the comment section what you think of this. I would love to hear your thoughts on it, as always. If you've got this far, please don't forget to subscribe, because I do talk about disabilities and things like that. So I hope that you are all well, and I'll see you next time.